Welcome back. We're here to talk about hair transplantation, which we now perform in our office. Specifically FUE, which is follicular unit extraction, and FUT, which is follicular unit transplantation. We perform both these here. FUE is performed using our two machines here. They're both a robot and our NeoGraft system as well. In this, individual follicular units are actually extracted from the donor site, which is typically in the side or the back of the head. Each of these follicular units contain 1 to 4 hairs. And depending on how much hair a patient needs, we need to extract somewhere between 500 to 4,500 individual follicles, which are then processed on a back table and then individually implanted into the areas that are experiencing hair loss. This is done under local anesthesia. The patients are awake, they can watch TV, they can listen to podcasts, and they're kept as comfortable as possible. These procedures typically last anywhere between 4 to 10 hours, depending on how much hair needs to be transplanted in that single setting. Now, Dr. Shaw will talk about FUT.
FUT is also known as the strip procedure, and you don't need any fancy machines to do that. So what the strip procedure is, it takes a strip of scalp, including all the follicular units in that area. So the result is, in this area, like right under here, usually we have a line after we take out the hair and close it up, and that strip of hair, it's taken back to the back table and it's processed. So there are certain advantages and disadvantages of this process. So first of all, you can get a lot of hair. So with follicular unit extraction, we don't want to completely take out the hair from an area. So the yields, you may not be able to get a really, really large transplantation process done all at once. Whereas with the strip procedure, you can take all of the hairs in that area. The main disadvantage is that there is a linear scar in that area. So for people who want to shave their head, they don't want to have a scar in that area, then FUE is the way to go because you really cannot see those scars. Whereas with FUT, you may see that scar, but if you wear your hair longer in the back, it's not going to matter.
Yeah. Just to kind of go off what Dr. Shah said, with FUE, those individual follicles are extracted. We make sure that they're extracted at certain intervals so we don't thin out the area of hair. You know, there is a tiny minuscule scar associated with the extraction of each follicle, but because it's so tiny, just to the visible eye, you cannot see it. So you can keep your hair closely shaven or closely cropped without seeing a linear scar with the FUE, which you would get in the FUT. So that's basically the breakdown of the two different procedures that we provide here at Hill Country Plastic Surgery. Please check out our website for more information.